Good morning again. This is Dr. Rob Franklin. I'm in Fredericksburg, Texas. I'm one of the founders of FullBucket, and I'm excited to talk with you this morning about foals. I've dedicated the past 18 years of my career as a veterinarian in specializing as an internal medicine specialist, and that involves the intensive care for foals. So over that time period, I've studied at Texas A&M University and the University of Florida, where I did my residency. I spent some time on the West Coast and outside of Los Angeles, and I set up 3 intensive care units, one overseas in Australia and back in Ocala, Florida, and also in Weatherford, Texas. And those intensive care units have just given me hundreds, probably more likely thousands of foals under my watch to be able to see abnormal behavior and also to see a lot of normal behavior and to see foals transition through illness back into normalcy. And so I've got a lot of experience to share with you. It is the time of year where we are on the front end of that bell curve that starts to fly up as the numbers of foalings really begin to peak in March and April, and then go back down in May and June. So we're right on the precipice of seeing those foals start to hit the ground, and a little prevention goes a long ways. A little knowledge and knowing what to expect, what you can do as a preventative measure, and also when you need to get the veterinarian involved is crucial to letting you know how to have the most successful outcome. You think about these foals, there's so much energy put into getting the foal on the ground. You've got to go through the whole breeding selection, the nick, and finding out the right stallion for your mare. You know, there's just so much consideration there. There's also a lot of financial implication, a lot of the advanced breeding techniques, the artificial insemination, embryo transfer, even the intracytoplasmic spermatozoa injection, or the ICSI. These are all very, very technical and very expensive procedures that we do to get foals on the ground. So once they're here, we've got to do our best to protect that 11 months and all the consideration that went into before the breeding. That investment we need to protect, and we need to get that foal off to a healthy start. So I guess the first thing that we need to consider is, when does a mare actually like to foal? Does she like to foal mid-morning, midday? What are her preferences? And really, if you watch a lot of mares and you talk to a lot of experienced breeding farm managers and night watchmen, and those people are just a wealth of knowledge. And anytime you get a chance to spend with them, always shut your mouth and open both your ears and take time, because they will tell you what years and hours of foaling out mares, which you just couldn't ever learn from any other source. So what they'll tell you is that a mare likes to be in a quiet and comfortable place. And you know, normally once all the hustle and bustle of the afternoon feed is done, the mares are brought in, and the lights go down, and the lights go down, and things really start to become quiet in the barn. That's when the mare will start looking out, and she's looking to see if it's safe. And once she feels like it's safe, then this is the time where she's actually going to think about allowing that natural process to develop. Of course, once the water breaks and they go into labor, that process you can't interrupt. But as a wild animal, the horse is naturally going to try to wait to foal when it's safe. They don't want to foal when there's a pack of coyotes running around, so they really try to do that. So the best thing you can do is to try to get a very quiet environment and a safe environment set up for your mare, and ideally do that as early in the day as you can. You'll talk to some experienced veterinarians and breeders. Dr. Kurt Harris told me, he's another veterinarian here in Fredericksburg and has a big breeding operation. And he was telling me that, you know, he really learned to bring his mares in and feed them their evening meal very early in the afternoon, and to allow all that hustle and bustle to quiet down, to have all the barn guys cleaned and out of there by 3 p.m. And he found that mares almost never foaled after 9 p.m. when he did that, because it allowed them that time to really settle into their environment and to make sure the coast is clear. And so when we do that, we keep ourselves from having to watch till 2 or 3 in the morning, which is a lot of times when the mare will foal is in the middle of the night, because it's taken that much time for all the noise to quiet down. So number one, she wants to foal whenever it's safe. So try to create a safe environment. The other thing you should say is, you know, where to foal. And, you know, everyone thinks about foaling in a stall. Really, we should foal our mares out in a stall whenever we've got inclement weather. That's really the only excuse to foal a mare in the stall. If you have a nice grassy paddock, if you live in Texas where we've had amazing spring weather already here this late winter, we've got green grass all over the place. Green grass and larger paddocks, that allows that mare to pick a clean area. If you think about where do they normally foal in the wild, they foal away from the herd. So they want to get away from all the fecal material and all the traffic and you know, potential pathogens or things that cause disease. And they want to pick a clean area away from the herd. So they'll do that naturally if you give them a paddock or a pen to do that in. Of course, you know, there's probably not much advantage in finding some old dry lot that the baby's just going to be born in a you know, an area that's never clean. That's obviously not a good scenario. But if you do have access to a nice clean paddock, then that is actually ideal. A good friend of mine, Dr. Jeff Foaling in Weatherford, recommended to me years ago that he always liked to foal his mares out in a grassy paddock. And I watched Dr. Foaling and I watched his mares, and I saw the results, and it always ended up to be a nice start for that foal. And I've listened to that, and I've passed that recommendation on, and I think it's a wise one. Again, the temptation is to deliver the foal in the stall, and the reason that may be a good idea is, again, if we've got inclement weather, if you're in Kentucky, if you're up in the Midwest where you've had all these snowstorms blowing in, obviously you don't want to have the foal out in that bad weather. It can suffer from hypothermia, never get a good start, and you'll lose those foals. But if you've got good weather, then outside. But that's the main reason to be inside. The other reason to be inside is if you don't have a clean environment outside. So even if the weather's okay, if you just have dirt lots full of feces, that's manure, that's not going to be ideal. So letting those foals go in the stall, you know, protects them, but also what it does is it concentrates pathogens or disease-causing bacteria, and a lot of those come from the feces or the manure of the mare, and sometimes that comes from other mares. So a lot of breeding operations will have 1 or 2 stalls where every foal is born, and it's kind of like they call it a foaling stall. It's a nursery environment. A lot of times that stall is bigger. It's maybe a 10 by 20 or 12 by 24 instead of a 10 by 10 or 12 by 12, which is great. Gives that mare plenty of room to move around and to get comfortable to have that foal. But it, again, you know, one foal may develop a very severe illness early on, and normally they'll pick that up from the mare, and then they will from the mare's manure. And then they end up inoculating that stall, and it just becomes a cycle where it's hard to break, because each foal populates more and more pathogens in that stall, and so that stall just becomes a petri dish of disease. And so we just see these massive outbreaks sometimes in these breeding farms where we're using a single stall to foal out every foal, and it's very difficult to disinfect stalls. When you think about trying to get porous surfaces like wood, or if you've got clay bottom or dirt bottom floors, trying to get those actually sterilized, you can't do it. So and a lot of these bacteria have protective spores, which is kind of an encapsulation that keeps them from being affected by things like sunlight or even some of the chemicals that we use as disinfectants. So it's difficult to control those outbreaks. And normally when I go in to consult with them, we put a lot of preventative measures in there, but one of the preventative measures that we use is just getting the foal out and actually using either a different stall or ideally, as we discussed a few minutes ago, using a grassy paddock and allowing that mare to foal there. So if you imagined you had even a 1 acre little grassy turnout and you were foaling out 20 mares, those mares are not going to fold out on top of each other like if you are putting them in a 12 by 24 stall. They're going to pick different areas, and so you have a less likely opportunity to concentrate those bad bacteria. So we know that the mare is going to go at night whenever things are quiet. The way we can encourage that to go a little bit earlier is to quieten the barn down earlier. So again, trying to feed the mares and get everything quietened down, in the early afternoon, so they'll foal in the late evening and early night. We're going to either prepare a stall by putting fresh bedding in there. We're going to disinfect it if there's been another mare that has been foaling in there beforehand. And you can do that by using a dilute. Again, first, remove all the fecal material and any organic substance, so dirt and things. The disinfectants will not penetrate that, so you've got to remove that, remove old bedding, put your dilute bleach in there, and you can, and then you can put in your fresh bedding. Or else we're going to pick a nice grassy paddock for them to foal out if the weather's good. And then we need to know, when are they going to go? And typically the old horsemen will look at the back end of the mare to look for the vulva or the external reproductive tract of the mare to soften, where those ligaments begin to loosen in the pelvis. We'll begin to look at the teats and looking for that wax. That wax, of course, is the seal, as the colostrum of the first milk is concentrated in the udder. A little bit of that is leaked out, and that as soon as it hits the air, it dries into a waxy substance, and it creates a wax seal, so that as the mare concentrates that colostrum, which is a one-time event, she only makes one batch of colostrum, and it can't be leaked out, that waxy seal keeps it in there. And so normally whenever the mare waxes up, we know that she's soon to be foaling. So those are some good estimates. There are some other things you can do. Of course, there's a system where we can sew a little monitor into the mare's vagina or vulva, and where as soon as the water begins to break and that vulva opens up, a little magnetic sensor is separated, and it will trip your cell phone, and you'll get an alert, and it'll sound an alarm in the barn and let you know that there's a mare that's going to go. That's a great process, and a lot of big breeding farms use it. It's a little bit of a capital outlay to get set up, but they are handy. Those are called a foal alert system, and they're a great system. There's also systems that act as a surcingle that go around the mare's withers, and when she lays down, it has a little sensor in there that tells you she's laying down, and will again trip an alarm and send a signal. You get quite a few false alarms with those. With the foal alert, you can get mares that if you put them in too early or don't put them in correctly, the mares will itch and scratch and they'll rub those out, and you have to constantly replace those. So a couple of downsides there. There's also some tests that you can use to predict the foaling, to know if the mare is going to go. And the traditional one is called a predictive foal, and it uses calcium or water hardness testing, and it's a multi-step process. It's been around for a long time. It doesn't take too long. You just collect some milk and you run it through some samples. We found that to be useful whenever, especially when we have mares foaling out that are high-risk mares that we're trying to, we may have a foal alert in them, but we really want to know, what day they're going to foal out. We don't want to, be on our heels on that when that foal's coming. So we would test them there. Probably about 4 or 5 years ago, there was some research that showed that there was actually, you can measure the pH, or the acid and base status of the mare's milk before foaling, and you could determine that she was going to foal or not foal using a very simple pH litmus paper that, if you remember from junior high science, just have a little strip of paper, and it will tell you the acid base status of it. And some of that paper tells you specific ranges. Well, if you look at a very narrow range, you can actually tell when a mare is going to foal based off of the pH. And so we actually, because no one was making them, we went out and got the litmus paper and put together the key and everything. So we actually sell those at FullBucket. They're very inexpensive and they're very easy to use. And again, this is just something that we saw the research out there. There was no commercial manufacturer for this and for the horses, and so we've got that, and that's our mare predictor strips. And so it's very easy. It's 1 drop of milk goes on the litmus paper, and it'll tell you with over 98% certainty when that mare is going to foal. So very handy thing to know, especially if you're running a smaller operation. You know, there's some smaller operations that have very good mares. There's a great place called Blue Stem Ranch in Weatherford that Mr. Bob Kingsley owns, and his ranch manager Mike Ziegler likes to. He normally just has a couple of foals born each year, but they're very, very special foals, and Mike likes to know when those mares are going to go, and so he can make sure he's there and that Mr. Kingsley's there, and so they'll use these foal predictor strips, and so Mike has a good idea that that mare is going to go or not go, and so he can spend his time and concentrate his time at the barn, and so that they're there the right night. So many times we hear stories about people that, you know, are anticipating a prize foal to be born, and for 2 weeks they're there every night, you know, waiting for that foal to be born, and you know, they just get plumb wore out, and they finally you know, they finally go to sleep, and on that 15th night, and lo and behold, when do you think that mare goes ahead and foals? It's that night. So this predictor strip really can help focus your energy on when to attend the foaling. So we've talked about where to foal, so preferably outside if the weather's good, in a grassy paddock, inside if it's not, and we've talked about preparing our stall to disinfect it, to put in new bedding. We talked about that the mare likes to foal whenever things are quiet, so want to go ahead and feed early, get the noise down, let them have that serenity so that they can begin to get comfortable and do that, and hopefully they do that before bedtime for us, so that we can make sure that they've got a good start and it's not happening at 2 or 3 in the morning. And then we also talked about, you know, trying to get a good idea when that's going to happen. So we talked about relaxing the vulva, relaxing that tail head, beginning to wax up at the teats, and then actually going in and measuring the pH of the mare's milk to get a good idea of when that's going to happen. So that's getting ready for the mare. Now, what happens whenever the mare actually foals? And so, you know, a lot of people have seen cattle and goats and different farm animals foal, and so they have some context, but if you haven't watched a lot of mares foal, you may not be sure on the timing. And, you know, watching that timing is important. The timing occurs very rapidly in the mare compared to other farm animal species, and a train wreck can end in a dead foal and sometimes a dead mare very quickly as well. So that's why, especially these high-end breeding operations, we really like to attend that foaling so that we can make sure that we don't run into those train wrecks, because there's just very little margin for error. So what is the normal process? The normal process is that the mare, there's 3 stages of labor, and the first stage, or stage 1, is just the mare beginning to position. So a lot of stuff is happening inside. The uterus is beginning to contract. The baby's been rotated. Its feet have begun to engage the birth canal. Its head's getting straight, and the mare's just getting everything situated. And so normally in stage 1 you'll see just the mare circling around the stall. She may get up and lay down. People sometimes think that they're colicking. They're just getting everything lined up just right so they can shoot that 100-pound foal out their backside. Stage 1 can go on for quite a while. It can go on for several hours. Now, stage 2, that really starts a clock, and that is whenever the placenta goes ahead and comes out and opens and the water's broke. And what you're seeing is the placenta is that sac that the baby's being formed inside the mare, and that fluid is what bathes that baby and provides some of its nutrients, also helps it eliminate some wastes, and that fluid will rush out. That fluid's typically kind of a clear yellow color. If it's thick or if it's red, then that could indicate a problem. But typically you'll just see a rush of water come out there, and that says that, hey, the labor process has begun in earnest, and that's where you want to be really setting your clock. And if people call us and they say, hey, my mare's been in labor, first thing we say is, how long has it been since her water broke? Because we know that there's really about a 30-minute window for that baby to get out. And if that baby's not out there real quick, then again, it can begin to lose oxygen supply, and ultimately you can lose the baby. So breaking the water is the sign of stage 2. It should go 30 minutes. From there, we should have a baby on the ground. And typically what you'll see is the 2 front hooves and the nose coming out at the beginning. And then some mares will foal standing. Most mares will foal down. And through a series of pushes and grunts, they'll be able to get the shoulders out. The shoulders are kind of a tight spot. The mid back will pass fairly easily. And then getting the pelvis or the hips, that's the other tricky part, where it's a big object going through the birth canal. And some of them will get hung up there as well. But you'll typically see the head, the feet come out, then the shoulders, and then the pelvis, and then it all kind of happens at once there, and the baby's on the ground. So that's what you should see. People say, when do I get involved? The first thing to know is that if you ever see a red velvety structure coming out the vulva that looks like a red balloon like this, that's called a red bag, and that means that the water never broke and that the placenta is just coming out on its own. Well, as soon as that placenta detaches from the mare's uterus lining, that is essentially cut off the lifeline for that foal, meaning there's no more circulation going to that foal, and that foal will suffocate very quickly. And so the first thing, if you ever see a red velvet sac coming out of that vulva, is to take your pocket knife and open that and allow that water to break and allow that foal to come on out. So that would be one time to get involved. Number 2 is if you only see 1 foot in the nose, or if you see 2 feet and no nose, or if you see the hooves upside down, which typically that'll be the back feet, those are times you need to immediately call your veterinarian. That indicates you've got a position problem with the foal coming out, and you need to get some help ASAP. Now, if they're on the ground and they're pushing, and there's nothing wrong with gently grabbing the forelimbs, if everything, the head's coming out, the forelimbs are there, and giving pulling as they're pushing, there's nothing wrong with doing that. I normally will really try to stay away and allow the mare to do her own thing, and not get involved unless I feel like that the clock is beginning to burn and that we're not making steady progress. So as long as you're seeing steady progress, really hands off, let the mare do her thing, unless you've got some of those problems that we discussed with a red velvety bag, or upside down hooves, 1 hoof, 2 hoofs, no head, any of those things that tells you to get on the horn. Okay, so that is stage 2 of labor. I did mention there were 3 stages of labor. That the final stage of labor is the expulsion of the placenta or the afterbirth. And normally that doesn't occur for a little bit of time after foaling. And so that leads me to the next 1, 2, 3. So we talked about 3 stages of labor. The first stage typified by the mare being a little restless, laying down, circling, up and down type of behavior. Stage 2 being the water breaking, and then the rapid process of foaling, which occurs within 30 minutes after that. And then stage 3 is the passing of the afterbirth. If we look at it from another angle, there's a rule of thumb that I like to tell people. It's just the rule of 1, 2, 3. So after a foal has been born, it has exactly 1 hour to stand. Now, most foals will stand very quickly after being born, but if it has not stood in an hour, you need to call your veterinarian. There's a problem. Okay. 2 is in 2 hours that foal needs to have nursed. Again, most foals will stand very quickly and they will nurse very quickly after birth. But if that foal has stood within an hour, but it is not drank by 2, then you need to call your veterinarian. And 3 is within 3 hours that placenta needs to have been passed, and it needs to be passed in entirety. And what typically I will recommend is that people go ahead and stretch the placenta out. You'll see kind of a white membrane. That is that part is the amnion that surrounds the foal. That's not really part that gets left behind in the mare. The part that gets left behind in the mare is the velvety part. On one side, it's got a bunch of blood vessels that are kind of bluey, purpley in color, and on the other side, it's sort of like the soft side of a Velcro, and that's where it's actually attached. So I like, and that part, the allantois, of the afterbirth, that's the part that really needs to be stretched out. And you want to stretch it out, and what you'll find is there's 2 horns in there, and it'll kind of shape like an F if you lay it out right. So 1 horn here, 1 horn here, and then the body of the placenta here. And so I get my clients to lay it out as an F, to stretch out those horns, and to make sure that the tip of this horn, so it looks like a sock, just you should not be missing the toe part of the sock. And on both of those, that's typically the part that gets left behind in there. We get a retained placenta or a piece of the placenta. And then the body, it should all be intact. So I want to, number 1, I want to see the whole placenta. And then number 2, I wanted to characterize the placenta. So is it overly thick? Is there a discharge that's associated with it, indicating the mare had an infection that she was harboring during that process, which would necessitate treatment for both the mare and the foal if that was occurring. And if there's pieces left behind, it certainly we have to get in there and doctor on the mare to get that out. It will cause a severe infection in the mare and will affect her ability to breed back as well. So normally I'll have my clients lay that out, take a picture of it as they tell me what's going on with the foal. And then I will have them save that. And so normally just a 5-gallon bucket, drop it in there. If it's hot outside and you're worried about it spoiling, you can just put some water on it and maybe put something on top so it doesn't dry out too much. And then whenever we come out to do our foal check, normally you'll see the veterinarian, he'll want to see the placenta. Don't throw it out there for the dogs. Don't throw it in the dumpster. We want to see it, and we want to characterize the placenta, and we want to evaluate that the whole placenta has been passed. Otherwise, we got to go looking for little parts that are left behind. So if the foal is not up in an hour, as we said, 1, 2, 3. So 1 hour, the foal has to get up. If it's not up, there's a problem. Call the veterinarian. 2 is it needs to have nursed by 2 hours. If it has not nursed, then call the veterinarian. Number 3 is the mare should have passed that placenta in its entirety within 3 hours. So 1, 2, 3. And those are good, easy rules to live by. We know that labor is defined by 3 stages: stage 1, stage 2, and stage 3. After they break their water, stage 2 should last no longer than 30 minutes, and you should have a live foal on the ground. So what are some things that we can do to try to get the baby off to a good start during that period of time? Well, one thing is that we have to think that mare has a source of basically immunity in her udder, and it's really a race for that baby to get that colostrum inside its digestive tract. Once it does that, it actually absorbs that colostrum into its bloodstream, and it gives it the fighting antibodies into its bloodstream so it can ward off disease for the first 2 to 4 months of its life. It depends on those antibodies. So it's just crucial that farm animals, and horses are part of that, get that colostrum. Unlike human babies, where a lot of that antibody transfer occurs across the placenta from the mom to the infant, it does not occur in farm animals. So they have to get that colostral meal. Now, if you notice that whenever I told you about the 1-2-3 rule, we talked about it has up to 2 hours to nurse, and we consider that normal. And a lot of that time that baby stands up in that first hour, it begins to nurse on a lot of stuff. There's something in its brain that's telling it, I've got to nurse, but it takes a while to know where to go. You'll see a good broodmare will nudge the baby to the right place. It will try to present that udder, but that baby will nurse all kinds of parts of the stall. It will nurse around the backside of the mare. It will nurse on the mare's shoulder. It will nurse all over, looking for that teat. And while it's doing that, it is really picking up lots of different bacteria in the environment. Every environment has bacteria in it. Our skin has bacteria. The stall walls have bacteria. Green, beautiful paddocks have bacteria. Bacteria are normal. Whenever we have feces, we have trillions of bacteria that are passed in the manure, and what we're trying to avoid are pathogens or bad things like E. coli, salmonella, Clostridium, things that are there in low numbers typically, but that we should see the foals not have a struggle with in terms of developing an infection. Now, while they're nursing or looking for that udder, they will sometimes pick up those pathogens, and so it's a race. So now that pathogen has already gained access to the foal's digestive tract, where it can set up an infection, and we haven't even got the colostrum in yet. Especially if the baby delays its ingestion of the colostrum, or the mare has poor quality colostrum, which we oftentimes don't find out for 18 to 24 hours till our vet check, then we've really had a race that the gun went off, hours before. The salmonella has already gotten in there, and we haven't even we won't be able to catch up. So one thing that you can do as a preventative measure is you can actually give that foal a product that has antibodies in it, or immunoglobulins. And at FullBucket, we designed a product that's called Kickstart. And so what you do is, as soon as that foal is born, you give it half a tube of this 80-gram tube into the mouth, and then at 6 hours later, you give it the other half the tube. And what that does is that just allows that entire digestive tract to be coated with antibodies or immunoglobulins, so that if some of those bad bacteria get ingested, then the foal can actually, or that product will actually cleave or bind those pathogens and not allow them to cause an infection. It doesn't act as a colostrum replacer. There's really not a good colostrum replacer that's commercially available. You can get banked colostrum if you live in a horse-dense area where mares that make a lot of colostrum. Sometimes horsemen will save a pint for orphan foals, or for foals whose mares don't have colostrum, or babies have to get a plasma transfusion. Which leads us to the next thing is, when do you get the vet involved? So just to recap that, so that the baby should nurse within 2 hours, but in that 2-hour period, it can be exposed to a lot of pathogens. So we like to use the full Kickstart as a way to just coat that intestinal tract with antibodies to prevent the infection. So when should the veterinarian come out? We always recommend that you get a new foal examination between 18 and 24 hours of age. Why then? If we go before that, then we won't be able to evaluate if that foal has ingested enough colostrum. And that's very important to know if that foal has ingested enough colostrum. It's quite possibly the most important thing. So we typically will delay a normal foal exam for that 18 to 24 hours. So one thing that you want to take note of is that if there's an issue going on with the foal, the vet needs to come out before that 18-24 hours. Don't wait. If you're seeing the foal have diarrhea, in the first 12 hours, or it's becoming lethargic or something, then or if it hadn't met the 1, 2, 3 criteria with standing in an hour, nursing in 2, and the mare hadn't dropped the placenta in 3, then have the veterinarian come on out before then. So don't wait for the 18 to 24 hours. But the 18 to 24 hours, if everything else has gone the way it should, foal's been nursing, the mare's doing well, then we'll come out, we'll evaluate the foal at 18 to 24 hours. We'll look at the mare, we'll make sure her reproductive tract is fine, it wasn't injured during the foaling process, and we'll look at the foal, we'll do a physical exam, make sure there's no congenital abnormalities, birth defects, make sure the eyes are good, the heart's good, and that orthopedically, as far as the bone structure, that everything is as it should be. And then we'll take a blood sample. And we'll do part of the screening that we'll do is we'll actually do this test. It's called a SNAP test or an IgG test. There's several different methodologies to evaluate it, and your veterinarian may have a different preference. But basically, what we're trying to do is we're trying to measure. Okay, did that baby drink enough colostrum? Was the colostrum high enough quality to be able to raise the antibody levels in the blood of the foal to give it immune protection against disease? And so that test hopefully will come back positive at greater than 800. And if your vet says, yep, they had a really strong test, most of them are over 2,000, but our sort of threshold, minimum threshold is 800. Then thumbs up, got a good colostral meal. If it didn't get that, then what you have to understand is that the intestinal tract is already closed. So after 18 to 24 hours, you can absorb more colostrum. So you can't just add colostrum into the foal system. You actually have to go ahead and give it an IV plasma transfusion. And so what your veterinarian will do is it'll determine if it needs 1 or 2 liters, and it will give the plasma, and then we'll measure that level again and make sure that we've given enough. And your veterinarian may or may not decide to put the foal on antibiotics at that time as well, depending on how the foal is doing and what the situation is. One thing that we should also mention is that there is, you can actually look at that colostrum when the baby's first born and evaluate that colostrum to see if it even has the ability to be rich enough to pass on those antibodies. A lot of old horsemen will say, "Oh yeah, if it's thick and yellow, it's good." We actually know that is not true. That while that can be a good indicator that it's a good quality colostrum, there are some circumstances where that thick yellow is actually not full of all the antibodies that we'd hoped it would be. And what you can do is you can buy a type of refractometer, which is a little device that looks like a tube that light passes through one end, kind of like a prism, and it has a monocular view where you can look through that and you can measure the quality of the colostrum. And this particular one that we found is useful is called a BRIX, or BRIX refractometer, and that's used in the wine and beer industry in terms of looking at alcohol and sugar content and grapes. And so we found that you can actually put colostrum on there, and if you measure your colostrum, especially if it's over 23%, that it's going to be very strong colostrum. So that can be a very good indicator that early on that as long as the foal nurses, it should be off to a good start. But if it has very poor quality colostrum, and especially less than 19%, then you're going to want to call your veterinarian, and you're going to want to have them come out earlier. And they may, again, if you're in a horse dense area, you may find a source of banked colostrum that you can give the baby a transfusion, or your veterinarian can tube the baby with the colostrum, or you can feed it with a bottle. But you have the window of opportunity to get the colostrum in through the digestive tract versus having to do the IV plasma. The IV plasma is a life-saving thing, and we should always do it. But the thing we have to remember is that there's a lot of the immunity that occurs in the gut, and that colostrum, it doesn't just have immunoglobulins. There's other things that are passed on in there that actually help the baby fight off infection. And so there's really no good replacement for colostrum other than colostrum itself. So we only do the plasma if we miss that opportunity to go in there and to give the the colostrum orally or with a stomach tube. So that's 18 to 24 hours. Hopefully the check goes good. Your veterinarian gives a thumbs up that there's no congenital abnormalities, that all the vital signs are good, that the mare has cleaned okay and her reproductive tract is sound. And after that, you should be good to go. And then you say, well, what's next? And probably what's next is a period of about 6 to 7 days of hopefully nothing but good news. But that really is the window where that foal can be exposed to lots of different pathogens, especially in breeding farms, where we have a lot of mares and foals interacting with each other, and where foals can get sick, and that sickness is not mild. It oftentimes results in a trip to the neonatal intensive care unit, IV antibiotics, fluid therapy, nursing care, and thousands of dollars, and potentially a lost foal if things don't go our way. So you do want to continue to take some proactive measures there. As we mentioned, we do like to recommend our foal kickstart whenever we're talking about the first day of life. After the first day, once that intestinal tract is closed down, meaning things aren't being absorbed, big particles are not being absorbed like antibodies, we actually like to put a coat of probiotics in there. And we do that for that first week of life. That first week of life, that entire digestive tract is basically a sterile petri dish. And if you think of a petri dish as that flat dish that we use to culture things in the lab, that is something that is able to grow bacteria, but when you start off with a clean one or a sterile one, there's nothing on it. And that's the same for a foal. As they get older, their entire intestinal tract from mouth to anus is lined with different beneficial bacteria and yeast. And those bacteria and yeast serve to work in the same way that we have bacteria on our skin that are beneficial to us. Some of the bacteria help us digest our food. Some of it helps to act as a live barrier against some of the pathogens that can invade. And so there's always, in all of nature, there's always a beneficial with probiotic or with natural, normal microflora that we call them, existing with the host, right? And so you want that to occur. Now, how does that occur naturally? Well, normally in the foal, they're going to pick that up in their environment. And what you're hoping is that they're picking up good and not bad. And if you study foals quite a bit, and you know, one of my earliest people that taught me about foals was Dr. Armstrong out in California, and she would get me to watch foals, and she would get me to notice how that foal would go over to that mare's pile of manure, and it would actually sample some of that. And people get very disgusted by it, but as Dr. Armstrong would say, you know, this is actually something that is occurring naturally, so that baby can take on some of that good microflora from the mare. Now, the catch is that you hope that all that is good, and in nature it probably is. But if that mare has been on antibiotics, we know that antibiotics totally disrupt that normal microflora, right? And so that baby is not being exposed to a normal microflora in that manure. It's being exposed to one that's been crushed with antibiotics and has allowed maybe abnormal bacteria to expand in there, and so you don't get that normal dose. We know that some mares have a change in their diet, and where all of a sudden they're given a bunch of grain. We know that immediately disrupts their microflora as well. And so I guess what I'm getting at is that they should naturally get the microflora from their environment, and that does occur in a natural setting, in a herd-bound bunch of Mustangs out on the BLM. That's going to occur. But in our modern day environment, the way that we house our foals and the way we doctor on our mares, a lot of times a normal source of the microflora is not there. And that's where we can get a good start with a well-designed probiotic, which the foal probiotic is that we make at FullBucket is the only probiotic designed specifically for foals. And what that does is it allows that intestinal tract to be coated with beneficial bacteria and yeast during that first week of life, when they're, you know, very, very exposed to getting disease, because that normal microflora is not existing in their digestive tract. So we're not trying to mimic the mare's manure. We're not trying to give them an artificial source. We're giving them a protective source that keeps the competitive advantage in our favor for the foal until that foal has time to ingest enough diverse, and there's millions of different bacteria and yeast that the baby's going to be exposed to, and they're going to form their own sort of proper brew of microflora, and we want to provide them sort of a sentinel army that's in there that is keeping the bad guys at bay while they provide their own microflora over time. And so the next thing to expect is probably a little bit of loose manure around that 6 to 9 days. It's called foal heat diarrhea. A lot of times when we've given them probiotics, we don't see quite as much of that foal heat diarrhea. That foal heat diarrhea is really a big part of their digestive tract just coming alive and them beginning to use both enzymatic digestion and fermentation as digestion. And so they're getting exposed to lots of different things to eat, and they're getting exposed to lots of different things in their environment. So that will cause their digestive tract to sometimes have some very self-limiting pasty manure. But you should never see real watery manure. You should never see a foal get depressed, and you should never see a foal that doesn't want to run around and play. And that really brings us back to what is normal behavior in that neonate. And that neonate would typically look like a foal that likes to sleep. After it sleeps, it'll typically stand up, have a good stretch. It'll pee. When it does urinate, the urine will be very clear, indicating it's drinking plenty of fluid, and it should be a large volume of urine. And then it'll typically have a little bit of a play and a suck, and maybe a little more play and a suck, and then it will take another nap. And that process just repeats itself over and over, multiple times throughout the day. The foal should get up, multiple times throughout the hour, and have that same routine of peeing, playing, and nursing, and then back to sleep. So look for that as a normal thing. I think we've gone through everything from top to bottom on what you should expect. Another common question people ask is what about turnout? Should I let my foal go out, or should I have my foal inside? Foals when they're born, they are ready to run. They're born to run, and if you watch a lot of National Geographic, you can see a lot of the hoof stock that are born in nature. They have to run, or they're dead. And so foals are no different. They're designed to outrun cougars and coyotes and bobcats, and so they can go outside. The only reason not to go outside is if your veterinarian has determined there's an orthopedic problem or some sort of alignment problem with the bones, or that the bones are not finished forming sufficiently, or if you've got severely inclement weather. Of course, you don't want to challenge the foal, be like sending your kids out, whenever there's a snowstorm. You don't necessarily want to do that. But are they ready to be out? You bet. And in fact, not only are they ready to be out, but the mare's ready to be out as well. Reproductive veterinarians, they really are challenged by mares that have to stay in a stall. So as a foal doctor, if I put the say, oh, this foal's got to stay in, it's sick, or its bones aren't right, or any variety of reasons it's got to stay in a stall, the reproductive veterinarians get very upset with us because they know that mare needs to get out. And when she gets out and she moves around, it allows her reproductive tract that was just housing this 100-pound baby, it allows it to involute, or to come back and to tighten, to eliminate all the fluids, all the edema, all the blood, any possible infection, low grade. It allows them to eliminate that. Just simply moving around allows them to do that. Whenever they nurse, they get a little surge of oxytocin that helps contract the uterus and expel fluid. And again, that is, the more we can get those mares moving around, the healthier they're going to be, and the healthier their reproductive tract, and the better chance they can breed back on foal heat or on that first cycle right after foal heat. So let's do a quick review as we sort of round up. If there's any questions, certainly ping in. But we talked about getting ready. We talked about the fact that a mare likes to foal once it's quiet, so we can get the barn quietened down earlier in the day. The mare's going to go typically earlier in the night. We talked about foaling outside if at all possible. A green paddock is the ideal place to have a foal born, barring any inclement weather. Otherwise, we're going to disinfect our stall. We're going to remove old organic debris, old bedding, manure, dirt, especially if you're in a situation where multiple foals are being born in the same stall, one after another. Everything comes out. We're going to disinfect with dilute bleach, and then we're going to rebed with fresh. And then we're going to start to look for the signs of parturition, look for the vulva to be loosening, look for the tail head to soften, look for that wax to form. On the teat, we're going to go ahead and measure the pH of that milk to make sure we know when that baby's going to come out. Also, one thing we didn't mention is a good idea that, especially if the mare is extremely dirty, is to wash that udder and that area around the back end right after that foal is born, so that as that baby is searching around for that first meal, that it can find it's not being challenged by too much manure and debris around that udder or that back end of that mare. We talked about attending the birth. We talked about the rules of that there's 3 stages of labor. First stage is just the mare getting positioned right, that she's a little unsettled. Stage 2, the water breaks. The baby should come out in 30 minutes after that. Stage 3 is the expulsion of the placental or fetal membranes. That should occur within 3 hours. Then we talked about the 1-2-3 rule. In 1 hour, the baby should stand. In 2 hours, it should suck. In 3 hours, the placenta should be out of the mare. We talked about saving that placenta for your veterinarian to evaluate, laying it out in that F form so that you can make sure that the tips are there. And oftentimes, you can just text your veterinarian a picture of that until they come out and for their check. And then we talked about scheduling that check from 18 to 24 hours, where we can do the physical exam on the foal, on the mare, and evaluate that blood work to make sure that the foal has got the right amount of immunity. We talked about taking some proactive steps, putting the kickstart into the foal in that first when it's born, and at 6 hours to be able to coat its intestinal tract with immunoglobulins. And then after 24 hours, when that gut is closed, going ahead and keeping it on a healthy dose of full probiotic for that first week, so that we can allow that microflora to be to not be a sterile petri dish waiting on an infection, to have a competitive advantage with healthy bacteria and yeast involved in there. We talked about the fact that turnout is good for both the mare and the foal, and we talked about normal foal behavior of getting up, stretching, having a pee, having a play, getting a suck, and then repeating that process after a sleep. So I think that's it for the first 24 hours. Appreciate everyone coming out this morning, and it's just a beautiful spring or almost spring day here in Texas, and we just wish you the best in your foaling season. And if we can serve as to be a part of your team, whether with that product advice or just in the process of being good and doing good, then certainly let us do that. This is Dr. Rob Franklin with FullBucket. See ya.